So I think there's several key points that we need to focus on when we think about cultural competency, particularly when we're thinking about training. Number one, I think we need to acknowledge and share and teach the fact that culture matters in the delivery of health services, whether it be public health or clinical care. Culture matters. People's values, perspectives, beliefs need to be understood, respected, and we need to work with those issues as they emerge to deliver high-quality health care and health services. Number two is that we can, as healthcare providers, obtain a set of tools and skills that can help us do a better job at addressing each individual's social and cultural factors and how they impact with health and healthcare. So it's important to understand that certainly we need to have the appropriate set of attitudes and knowledge, but skills are really, really important in being able to address cross-cultural issues. And then finally, I'd say that we're pretty certain, and we will continue to build the evidence, that addressing cultural competence and addressing some of these challenges will improve health outcomes and help us address disparities and actually get us on the journey of achieving equity. So cultural competence, I think, is a way to get us to a place where we want to go, assuring that everybody gets the best we have to offer in healthcare. I think it's really important to achieve buy-in with healthcare providers and anybody involved in healthcare services as it relates to training in the area of cultural competence. And it's really all about framing. If we frame the issue of cultural competence as, I'm going to train you and fix you because you're broken, then people are going to shut down and they don't want to engage. If you can frame the issue of cultural competence as, every day we take care of patients of different backgrounds. We can share with you some tools and skills that can help you address some of the challenges you face, some of the things that cause you frustration on a day-to-day basis. When you know you have something to offer a patient, but for some reason you can't connect, you can't achieve that cooperation, we can give you a set of skills that can help you address those challenges. And at the end of the day, make you a more effective and caring and skilled healthcare provider and get your patients higher quality care and better outcomes. And as much as we could frame it that way and focus on evidence and skills and really improving outcomes for patients as well as satisfaction for providers, I think we've gone a long way in securing that buy-in. I've been very impressed with Liva, just getting to know them over the last few months and certainly getting to know them in my trip here to New Zealand. I think that the work that they're doing is really critical. I think that Liva is doing it really, really well. And the opportunity I had this morning to see the online cultural competence curriculum, let me just say this, I have probably 8 years of experience in cross-cultural training online. What I saw this morning was fantastic. It is, that online training looked to me to be engaging, it looked to be interactive, it looked to be case-based, it provided facts, but it was visually appealing. So I think that online training has all the ingredients for success. I think it'll be very well received. I think you'll see some significant knowledge gain among those who engage in it. And I really look forward to collaborating with Liva and actually learning from the work that they've done with that online program as well as all their other work here. So I've really enjoyed my time here. I've been here just for about 2 days, but I'm trying to maximize my time. It's certainly a beautiful country, incredible diversity. I think just being at this conference, I've had a chance to see and learn more about the Pacific peoples, about the indigenous peoples of New Zealand, and certainly the hospitality and the kindness that I've experienced in my short time here certainly makes me want to come back and certainly learn more about the country.